You know what? WeFit would probably be covered by insurance.
We don't cover weight loss medications, but we cover WeFit.
We should try stepping up and down on this like half-inch step like 1,000 times. So maybe that'll
get
help
it for you. Maybe that'll help. Oh my God, so fun.
You're listening to The Pelvic Freak Show
with your hosts, Amanda Neary and Hannah Meyer. Hey, Pelvic Freaks. Welcome back to another episode of The Pelvic Freak Show.
Where you're freaks for us and we're freaks for your pelvis, baby.
Guys, something crazy is happening today. We are having our first colleague on the podcast.
Hello.
Welcome, Dr. Hannah Kotsiris.
Thank you.
Your government name as of new.
Mm-hmm.
Hannah recently got married.
Thank you.
Welcome to the Pelvic Freak Show.
I'm excited to be here.
Actually, Hannah's such an important guest because it was just me, Amanda, and Hannah. Amanda and the two Hannahs.
Yeah.
For a while
For
at
a
the
long
start
time.
of TPI, the Pelvic Institute.
Yes.
And now we've just been growing. And when we started the podcast, we were like, Hannah, we've got to have you on for an
And
episode.
we're finally here.
And finally we have an episode.
2 years ago. Wow.
No, for real.
That's crazy.
Wow. Hannah, we like to start with our guests. We obviously know you, but the pelvic freaks don't. So do you want to tell them a little bit about why you got into pelvic floor therapy, what your background is in general, hobbies, anything that's fun about you?
Yeah. So I got into pelvic floor PT because I was a pelvic floor patient myself back in undergrad. And I kind of fell in love with it from there. And so in addition to pelvic floor PT, outside of work, my other hobbies, I would say, I don't know, it's so funny because you guys know me already, but like I do yoga. I just got a dog, so I have a big dog hobby right now.
Big German Shepherd.
Big German Shepherd.
That's going to be a therapy dog.
Yes, that will be very exciting. And then, yeah, we're doing a lot of DIY at the house right now.
They also bought a house.
Yeah, been busy out there.
For real.
And then,
And she just got married and she just got back from her honeymoon in Japan.
Yeah, we're finally slowing down, I think. So that's good.
Mm-hmm.
Yeah.
But yeah, everything's been busy.
I think it's super important to say that you got into pelvic floor therapy because you were a patient yourself.
100%. Yeah.
Can you tell us about that specifically? Like why being a patient took you to this field?
Well, a couple different reasons. One was because I feel like one in undergrad, two in PT school, we don't learn about pelvic floor therapy. And so working as a rehab aide at Athletico and all this stuff, I had no idea what that was. And it was really cool because I already had gotten accepted into PT school at this time. And so my physical therapist would like teach me things, and I would hold like the pelvic model and while she was doing internal, and I'd be like, where are you right now? And all this stuff. And so one, I think it was like the curiosity of it all because we don't learn enough about it. So it was a completely new thing. And then just how much it helped me. Cause these are all like secret things, you know, pee, poop, sex, pain, all of this stuff. Like we don't talk about, but it can play a big role in your life. And so those were kind of like the two big reasons why.
Yeah.
Yeah.
I mean, that's like why a ton of sports and ortho PTs go into physical therapy in general. They had an injury, they found this field and they wanted to know more about it. So it makes sense that we're getting more and more pelvic PTs that are experiencing that as the field grows. Mm-hmm. So it's very cool. Both of you were clinicians that I met that had laser focused on pelvic floor therapy, whereas I had the different experience. I went into PT for like sports and ortho initially. So it was always interesting hearing your guys' perspectives on why you got into it.
Yeah, I have patients come all the time that will eventually be like, so how do you become a pelvic floor
all
therapist?
The time.
Like, I think I kind of want to do this.
Yeah, all the time. It's super cool.
Yeah,
it is cool. Another cool thing about Hannah, she's not going to self-brag, but she does a lot of our blog research for the Pelvic Institute. We all have different strengths when it comes to marketing materials, and Hannah immediately was like, I love writing and I want to do blogs. And I was like, that's awesome because I don't want to do blogs. So that worked out so well. And part of the reason she's our guest on this episode is our July blog post was about this topic. And so Hannah had already done the research for that blog post, and I feel like she's way more equipped to speak on this topic than Hannah and I are. And we have our own takes on it, but less research guided. So this is going to be very exciting. Hannah, what are we talking about today? Hannah Meyer.
Yeah, we're talking about GLP-1 and its impacts in the ability to help patients that have PMOS, or I feel so good to say that lately.
Yeah.
Just to say it casually and like not go into detail about why it's cool to say that. PMOS, even though I just did.
Yeah.
PMOS and endometriosis. Because these are inflammatory conditions. So, I mean, we're going to get all into the meat and potatoes of it. Hannah is, at least. And we're going to kind of deep dive into it. But it's nice because I was like, yeah, we've been getting a lot of questions about this lately. And I was talking to Hannah at work. And Hannah was like, I've been doing a lot of research on this lately. And I'd be really, really down to talk about this on the podcast if you want. And I was like, let's freaking do it.
Yeah. And this topic is important because if you subscribe to any streaming service or watch TV, you're going to see an ad. Every other ad right now is for a GLP-1, whether it's the one that's funded by Peacock or the one that's most evidence-based. We are talking about this from a clinical standpoint because this is a real drug that's been around for a long time. And just now, we're getting a lot of rising skinny culture, as like Hannah and I have talked about a bit on the podcast. But this is being kind of twisted and marketed in a certain way where they know they're going to get like engagement from these ads. And so there's definitely a downside to the culture around this. So we will then get patients asking us about it, but they're, embarrassed to ask about it because they don't want to be associated with the GLP-1 that they're seeing on their Love Island ad. But they know that maybe this can be really helpful for the condition that they're experiencing.
Yeah. Like on TikTok, you'll scroll and you'll see like, GLP-1 is getting to the celebrities. It's not just affecting their body, it's affecting their faces. And it's like all these, and it's like demonizing GLP-1 or Wegovy or whatever it is, or any type of weight loss drug. Okay. Yeah. But we're here and we're going to talk about this later too, to talk about why it's so much more than weight loss. And that's not the reason. And whatever, I'm not going to spoil the episode for you, but this is a really important conversation because, and I also see it when people are like afraid to say that they're on like GLP-1 or something because of the backlash from social media.
It's very polarizing right now. Yeah.
And then just an important date. I know I mentioned that this drug has been around for a while, but it's been used since 2005 for type 2 diabetes. So I never heard of this drug growing up. So this is just a testament to how much marketing affects pharmaceuticals. And I actually forgot about pharma ads in the US because I had only been using Netflix and whatever for so long. And the second you're watching a sporting event and you're actually seeing advertisements, it is wild how every ad or every other ad is for a medication. So that those marketing and advertising of GLP-1s has definitely contributed to the talk around it too.
Yeah. All right. Should we dive into it?
Let's get into it.
Hannah, tell us literally just from the start, because from the average person that is hearing this episode, they see GLP-1, that is the average consumer is like seeing the social media content online, seeing that people are losing weight. That's like the bare knowledge of what they know. So tell us what GLP-1 actually is.
Yeah. So the whole reason I'm on this podcast is because I last year started anecdotally getting evidence from patients about GLP-1s. So the way that happened was I had about maybe 5 patients or so get on a GLP-1 for weight loss intentionally, who also had PMOS and or endometriosis. And again, anecdotally, they would report to me 4 months later, like I'm losing weight or I'm not, and that's important, and we'll go back to that later. But all my PMOS and endo symptoms are better or gone. And so I've been kind of like collecting little patient tidbits there, and that's how I arrived here today for this episode. Going back to what a GLP-1 is there's a lot of miscommunication with terminology. So GLP-1 is actually the hormone, glucagon-like peptide 1. And that hormone is naturally secreted in your body after you eat. So it's secreted in response to glucose. And what it does is it kind of works with glucagon and insulin, which are 2 digestive hormones. And it basically helps with insulin resistance and glucose regulation. why GLP-1 medications were created is because GLP-1 has a very short half-life in your body, meaning truly like you eat and then you have GLP-1 secreted and its half-life is 1 minute. So we never like saw any of these effects of GLP-1s because it's just not present in your body. So
very brief.
Totally. And then you have GLP-1 RAs, which is the medicine. So a GLP-1 is a hormone, technically, although in the podcast we'll probably use GLP-1, even though, just want to clarify to everyone, that is the hormone, where the medication is called a GLP-1 receptor agonist. So it kind of works in the way as like some other hormonal things, right? Metformin, some birth controls, where it's binding to the GLP-1 receptor, activating it, and thus simulating longer GLP-1 in the body.
Okay, that's a very important distinction to make.
100%. Yeah.
Cool. So it's secreted after we eat. What is its role in digestion then?
So that's a great question. This is what I found in my research. So I want to also disclaimer, I'm not like a weight loss doctor. I'm not, an MD, but so this is all from gathered research from the internet in recent years.
Yeah, and we'll link it in the episode description.
Great.
We'll link all the research links.
Good. Yeah, there's a lot. But basically, it works in like a lot of different ways. So yes, it slows gastric emptying, which we all know. And again, that's with insulin and glucagon. But it also works on your brain. So it's not like you have GLP-1 receptors in the brain, and it's also produced in the brain. And so that works mentally by creating like a sensation of fullness. So it's not necessarily the gastric emptying that is creating a sensation of fullness. It's happening in the brain itself. So there's also a little bit of a distinction there, as people say, oh, well, you're just not hungry because there's still a lot of food in your stomach, which is true. It's multifactorial, but it also works on a bunch of different things as well.
Mm-hmm.
Okay.
And that's actually an important distinction too, because I think a lot of people that are critics of GLP-1s are in TikTok comments saying, oh, this doesn't actually do anything. It just makes your stomach empty slower. They don't actually know what they're talking about, which,
yes,
as a surprise to no one, happens on social media.
100%.
Yeah.
Yeah. Do we want to talk a little bit about what the medications are on the market? Like what different types of GLP-1 medications are out there right now?
Yes. So there are a few. The biggest ones that I'm sure everyone's heard of are Ozempic, which is semaglutide, and Ozempic is the same thing as Wegovy. And then you have Zepbound, and that is the same thing as Mounjaro. So those are kind of like the big ones out, and those ones are tirzepatide. But then there's also one called liraglutide, which has been around for a long time. That I believe was one of the first. But there were a couple others that have been discontinued from the market. So if anyone's going to read the blog after this, those are not mentioned. But there's, I think, like maybe 20, but maybe 10 to 12 that were developed. And now on the market, we have about like those 3 big ones there. Mm-hmm. But also there's a new one coming out, or one that is out. It's called Foundeo. That is a pill. And then there's also a new GLP-1 coming out called like retaglutide or something like that, I believe. Mm-hmm. I can kind of pull it up after, but that one is not yet on the market. So you can go to Eli Lilly's website and kind of check it out, but those are kind of the big ones out right now.
Wait, would you say Eli Lilly?
Yeah, the pharmacy.
Oh, okay.
Yeah.
Gotcha. Mm-hmm. And these are all like the injectables.
Yes.
Medications, right? Except for the one that you said is a pill.
Well, also now they made Wegovy into a pill.
Oh, okay. I didn't actually know that.
Yes. So there's Foundeo and then there's Wegovy. Both can be oral. Why Foundeo was created is because the Wegovy pill is great. However, it's very picky. So you have to take it right when you wake up in the morning. So you're fasted. And then you have to wait 30 minutes before having any food, water, or taking other medications in the morning. So there's like a limitation with compliance there sometimes. So Foundeo is made because it's a different chemical and it can pass through the stomach easier. Again, I don't want to speak on all that physiology because that's not my specialty, but you can take it at any time without any restrictions.
Okay, so it's a little bit more less restrictive.
Totally.
Less restrictive.
Yeah.
So I don't know if this was like in our notes, but do we know how we came from this has been primarily used for diabetes to like now it's getting more rage? Do we know like how that kind of amplified?
Yeah, I mean, we, like Amanda said, we've had these medications since 2005.
Yeah. And
then anecdotally, I believe that people were noticing like, oh, I'm losing weight too, or something like that. Kind of like what happened with Viagra. And then it was released for weight loss in 2014. So people have been able to take it for weight loss since for the past 10 years or so. And then I think it just, someone in Hollywood found it and it like blew up or something.
No, for real.
Yeah, because then we were getting them like, again, tirzepatide just came out in 2023 and now we have Foundayo and like then Rett and like it's blown up so much.
That's an important distinction too, because when we mention type 2 diabetes, someone listening that doesn't know about GLP-1s might assume that the indication for that is weight loss still, because that can help with diabetic symptoms. But really, these are prescribed for insulin resistance. And if you think about the glucose mechanism behind it and prolonging that feeling of fullness, that can help the body regulate insulin spikes. So it makes sense that that helps with diabetics. And then I'm getting ahead of where this podcast is going, but if you think about the insulin resistance in PMOS,
yes,
it makes a lot of sense that this medication would also help with that.
Totally.
So it is fascinating that, we're creating these medications to treat certain things and then we're finding different benefits and obviously natural progression. As soon as weight loss is a thing, people are all over it.
Yes. No, for real. And wait, that was such an important take, because even though it was used to treat diabetes, it was not just about weight loss. Mm-hmm. It had a completely different benefit.
Yeah, they didn't know weight loss was going to happen.
Yeah.
It's kind of like metformin. It was like a new diabetes thing. Yeah. And then the weight loss was accidental.
And then the weight loss is what like blew up because
everyone loves that.
Everyone loves that.
Everyone loves that.
Yeah. Okay. So that takes us into kind of like our next like segment where we want to kind of jump into how was it not just about weight loss. So can you tell us a little bit about where else in the body GLP-1 shows up?
Yeah. So again, in my research, I found that yes, it's in our GI system, like we've been talking about, 2 in the brain, which is fascinating. That research is exploring brain connections and like going into dementia and Alzheimer's research. So that's a really cool thing to look into if you're interested. It's everywhere. It's on your skin. It's on your nervous system, like your central nervous system, not just the brain, but every other kind of like component of that. And kidneys, heart, truly you have GLP-1 receptors everywhere in your body pretty much.
Mm-hmm. Yeah. The preliminary research on dementia is really good too.
It's fascinating. Yeah. Truly. Yeah.
It's super interesting.
Yeah.
I do want to talk about the risk, because initially when I heard about GLP-1s this was maybe like post-COVID when I was working with some personal training clients that were on them. The first thing anyone talked about was, I don't want to get my gallbladder removed. Like I have this, I can't eat any fat. Do you know anything about that?
Yeah. So again, to not make the blog post super long, I didn't go too much into side effects, but I kind of made like an update or a looking ahead section, because you heard these sensationalized stories of like people went blind or people had pancreatitis or whatever. The gallbladder thing is real. And it's just because, which I'm sure we'll get into later, what is the effect of a GLP-1 versus weight loss. And so if you have rapid weight loss of any kind with or without a GLP-1, that can hurt your gallbladder, which that can also lead to pancreatitis, which again, rather than it being like, oh, it's attacking your pancreas or something, it's more of you lost weight too quickly, maybe without good diet or exercise, and then your gallbladder went out of whack, and then your pancreas went out of whack.
Wait, that's a really important note.
Yeah. So the gallbladder thing can happen, but all the other things they're finding are kind of a result of just rapid, unsupervised weight loss.
Yeah. Okay. So we talked about where GLP-1 lives in the body. What are some of the conditions that are currently being studied where this medication might be beneficial?
Totally. So like we already talked about dementia, Alzheimer's, so a lot of like central nervous system. I even saw things about multiple sclerosis and all these other neurological conditions, but even knee OA, which I thought was very interesting because there's going to be someone out there that's like, oh yeah, well, like you lost weight, so your OA is better. And in fact, again, they're finding GLP-1 receptors like at the level of the joint itself, and it's working in an anti-inflammatory way, like how you mentioned earlier. So again, want to make that distinction that it's not all about weight loss all the time. But in addition to OA, there's also liver, so non-alcoholic fatty liver. They're finding that it's reducing that content as well. Other anti-inflammatory conditions that we'll get into later, but endo, PMOS, also things like sleep apnea. And I thought one was interesting. 2 of them were mental health, depression and anxiety. That one's super new. So there's not a lot of research out there. I was able to find, I think, maybe 3 articles that were 2025 and up. But they're finding that, again, independent of weight loss. So not like, oh, I lost weight and I'm feeling better. People are improving in depression and anxiety. I do want to make a note about that too, though, that there is a warning on GLP-1's that it may worsen mood. So again, that's why that's there, because we're still exploring that.
That's new. It's newer.
Mm-hmm. And then chronic pain. So again, with like that anti-inflammatory component, a lot of people with chronic pain of any kind, Lyme's, fibromyalgia, etc., with that GLP-1 working on the central nervous system, that can be really helpful. Yeah, I think those are kind of the big ones. A lot of cardiovascular things, high blood pressure, atherosclerosis, kind of like honestly everything you can. I saw one about like eczema, like someone's eczema got better. Yeah.
Hell yeah.
Wow. Do you feel, my personal follow-up to this, do you feel like we're at risk of like this medication being used as a catch-all for a ton of things coming up because there is a lot of research in different areas? I think this question comes from, I guess, seeing all the advertising for it and how popularized it's getting. Obviously, it's being popularized for weight loss, but I think that's also, the government wants us to be buying GLP-1s, right? So yes. There's a distinction between like, this is really beneficial for these conditions that we're researching really well, but the general public isn't doing that research and looking into those conditions.
No, and also the problem with that is you can go online and get the medicine yourself.
Yeah.
What other prescription medication can I do that with? You know what I mean? I can't go on Roe and get Xanax, So that's also a very important point to make, is people are able to get it without any medical supervision, because again, maybe you have a pre-existing gallbladder condition, but you can go online on Mochi and go buy your own stuff. And so yeah, there's definitely like, that's why I think this episode is important, because there's a lot of good and bad with this medication. And of course, Big Pharma, wants us to buy GLP-1s.
Yeah,
for sure.
Oh, Big Pharma. Yeah. So that's just a disclaimer, if you're hearing, oh, well, this could be great for long-term dementia risk and all of these things, but you don't know, or you haven't been recommended this for your body, or haven't had this conversation, take the information from this episode, bring it to your doctor.
100%.
But don't just go online and buy this medication.
Yeah. It's crazy that you can do that.
I know.
Yeah.
I actually didn't know that you could do that.
Yeah.
Yeah. There's like AI doctors. I don't know. They're like, you're approved. There's no like telehealth. There's no like, they don't look at your, like you can lie and be like, yeah, my BMI is this. And it's like, yeah. So that's my problem with it too, is like people aren't able to get it through, or they are, but a lot of people are not getting it through physicians and someone to like, because again, it's a powerful medication, and it should be monitored just like any new medication, I feel like.
Do we have research yet on the efficacy of the pill version?
Yes.
It's good?
Yes. They say it's comparable to the injectable.
Oh, wow.
Yep.
Is that daily? Did you say that already?
Yes.
Okay.
It is daily.
Gotcha.
Yeah.
Wait, can we go back to just like how it's the conversation and how it's not just weight loss? Because there's so many people that are going to listen and hear like, oh yeah, like the NEOA thing. Can you explain a little bit more in detail about like why it is more just than weight loss?
Yeah, I can try without getting like too into the weeds about it.
Too technical?
Yeah, too technical. Because like, yeah, these articles that I'm like picking apart, it was like put me back in PT school, like all the research.
Make
and
it
like
fun
the
and flirty for us.
Yeah, seriously. So I will say in the most simplest of terms that there have been huge studies done on GLP-1s. A couple big ones are called SELECT. There's another one called like the LEAD trial or something like that. And they have found so we looked at all those things, NEOA, cardiovascular, what have you. They found benefit in those conditions before patients lost any weight. So to put it more simply like that, like if correlation isn't equaling causation here, people are seeing benefit before any meaningful weight loss. But to go a little bit more technical is, again, you have receptors for this hormone everywhere. So it's truly like you go, again, maybe atherosclerosis or blood pressure. And people can say, yeah, well, if you lose weight, those things are going to get better. And I'm not going to say that that's not true. However, it's working on the vessel itself. Like the GLP-1 is doing, it's regulating protein expression. It's regulating different hormones in your body. It's a gut-brain axis. So it's working on the level of the tissue itself. It's not, oh, my blood pressure is better because I lost weight. It's my blood pressure is better because this GLP-1 acted in such a way on my vasculature, if you will. So there's like two different reasons why it's not all about weight loss, because people are able to not lose weight and still see benefits.
Mm-hmm. God, I'm so happy Hannah's on this episode right now.
Yeah.
Because I can tell how into research you are.
Oh, yeah. I just think that this whole thing is so fascinating.
Yeah,
Mm-hmm. Yeah.
It is. It is. It's
and
a good conversation.
Just from like a physiological standpoint, if it has an anti-inflammatory effect, of course, that's going to help a painful joint.
100%. It's going to help a lot of things.
Present, right?
Yes.
And I love that it's not just about the weight loss for the NEOA, because we've been fighting that battle for years as PTs.
I know.
We're still dealing with
that
still
bone
do.
on bone.
Oh my God, that long bone.
Okay, so we're going to start to talk a little bit more about PMOS, endo specifically. Earlier we were saying, like, how did this get into specifically, like, as a weight loss drug when it was originally used for treatment for type 2 diabetes. Now we're going to be like, okay, how did it come to fruition that we're using it for, potentially to find patients to find benefits from chronic conditions like endometriosis, PMOS, things like that. But before we do, we kind of just wanted to say a little disclaimer about, the purpose of this episode. Hannah, if you want to dive in.
Yeah, I just wanted to put a disclaimer out that so far, this has been like a very positive episode, right? Like, GLP-1s help with all these things, and they could be groundbreaking for some of these like very debilitating diseases. But I did just want to let everyone know, like, there are two sides of the coin, right? And so we'll get in deeper a little bit of that later. But I did want to say, like, it's important to check with your doctor before starting any medication, kind of like we highlighted earlier, just so someone's able to supervise and things like that. Because we will get into also like the other side of it too.
Yeah. 100%. All right, let's kind of jump into PMOS, formerly PCOS, for those who, don't know that now. We do have an episode that we did, I think maybe like 4 or 5 episodes ago, on why they changed PCOS to PMOS. So if you guys want to reference that episode, definitely can. I don't know if you want to touch on a little bit about the name change at all, if that helps you kind of explain why GLP-1s have seemed to be beneficial for it.
Sure.
Yeah, go ahead.
So yeah, one great episode. You guys should definitely check it out for more detail. But what does the M stand for in PMOS? Is basically metabolic, right? So instead of now just looking at, it's like an ovarian problem, it's a metabolic, meaning metabolism is a whole body process. So that's why that name change was so important, because it's illustrating like it's not just at the level of the reproductive system, right? It's like a combination of everything. And so that is why GLP-1s have been helpful, again, preliminarily, for patients or people with PMOS, because like Amanda alluded to earlier, the insulin resistance piece. Most people with PMOS have insulin resistance. It does not to say that there's 100% of people, but it's most. And in clinical studies, people have been finding that insulin resistance has a role in all other PMOS symptoms. So it's a main driver of PMOS dysfunction, if you will. So a lot of people who have a lot of symptoms, insulin resistance is present, and that's what's driving a lot of these things. And that is where GLP-1s come in, because they are working on the metabolism, right? The insulin resistance. We just talked about how that mechanism of insulin, glucagon, fullness in the brain, right? All of that matters. And so it is, one, helping with insulin resistance, which helps with all those clinical symptoms. But it also, I don't know if you guys mentioned this, but basically PMOS is a lot of like androgens, or like male, quote unquote, sex hormones, right? And so they're also finding that in addition to insulin resistance, some research articles are coming out that it's also manipulating the level of androgens in the body. So it's working on like a bunch of different hormones basically at once. And with androgens perhaps being the main driver or the cause of PMOS, which we don't know, it can help with in that regard as well, like the actual reason why PMOS is a thing. Yeah.
This would be a good time for me to talk about my personal experience with this, because I was like dismissed from having PCOS because I don't have cysts. And then 2 years ago, I was talking to my new GP, who's awesome. And she was basically like, you have PCOS-ism, which was the cute version of PMOS now, because I never had any blood sugar issues, but I had insulin resistance and some of like a lot of the other symptoms because I had insulin resistance. She prescribed me a GLP-1, and it was a tirzepatide one. I haven't taken it in a while now because you can't like do it during egg freezing anyway. And it wasn't for weight loss, but it helped so much with the metabolic stuff.
Yeah.
And so it was like really interesting.
Yeah. Well,
I don't think you even knew that.
Well, I didn't. Yeah. I'm taking one right now.
Oh my God. Are you taking one too? That would have been so funny. But yeah, I have noticed in not being able to take it this summer that like some of the inflammation stuff has come back. Yeah. And she was cool in telling me about like the long-term benefits of it, or at least long-term lack of risk.
Sure, yes.
Because she was like, this is something you could take a low dose for a long period of time. Yeah. And you don't have to like take it for a year and stop. Because I wasn't taking it for weight loss. Yeah. But I'm thinking that it probably did help with weight maintenance once I started my SSRI.
100%.
Because otherwise that could have like made me gain more weight.
It could have.
So I didn't actually like take it for that or notice that too much. But I do notice now, like I just feel puffier not being on it.
The inflammation.
Yeah. It helps so much.
Yeah.
Whoa. I was wondering when you were going to drop your bomb.
I know. I was waiting to drop it.
But I wasn't expecting you to drop your bomb first.
That either.
We're all like the Spider-Man meme.
And you're like, what's going on?
I was like putting my headphones on while you were doing that, and I was like, wait, what did I just miss?
But I think part of the reason, definitely not why I didn't tell you, because I don't think I would have thought you cared at all, but like it's not easy to bring up, because every conversation with like a friend group, someone's talking shit on Ozempic, and I'm like, not everyone takes it for that reason.
That's what I'm saying.
There's other reasons people take these drugs, and they can be really life changing.
Also, too, like if someone wants to take it for weight loss, like,
for sure,
who gives a shit? You know what I'm saying? Like,
I know.
Again, like, is it going too far? Yeah, but if the average Joe's like, I've addicted to food, or like whatever, I need help. Like, dude, who cares?
Yeah. Do you want to talk about your experience on it?
Sure. Okay.
Do you want to do it now?
Yeah, we can also do it later.
No, we'll do it now. Okay, so how did this start? So it was like after those 5 patients that I saw, and I was like, maybe I kind of want to try this. And so I talked to my doctor, and she's really cool, just my PCP. And she was like, yeah, like give it a shot, you know, pun not intended. But she was like, yeah, like give it a try, see how it goes. Because basically I have endometriosis. I have not gotten diagnosed laparoscopically, but I have like all the clinical signs and symptoms, if you will. And so back in November is when I started tirzepatide, Zepbound injections. And I couldn't get it through my insurance because like I didn't qualify for it, so I did have to pay out of pocket for it. So that's another thing that we can talk about too, is like the barrier to care. But so I took that for 2 months, and at the time back in like maybe last March through October, I was having like just crazy symptoms that were getting too much. My periods were so painful, I could not even put a tampon in. I couldn't sit down. Like I was bleeding after intercourse and having breakthrough bleeding. And I went to my OB, and I was like, hey, I'm having all these things happening to me. I don't think my birth control is like keeping up with my symptom management anymore. And so then it was like, oh, do you want to try a new birth control? And I was like, not really, you know? And so I started trying this instead under the guidelines of my PCP, and all of it went away. Like literally all of it.
Wild.
Yeah. The breakthrough bleeding. And I messaged my OB and I was like, hey, like, just want to let you know, like, this is happening to me right now. And she was like, oh, okay, I don't know. Like,
it sounds good to you.
Literally. I was like,
that doesn't sound good.
That is not what I would have done, but
literally. And then I had to stop it because I got mono. And so I will say, I did not either go on it for weight loss specifically, but I did lose like probably maybe 5 pounds or something like that. And then mono came in. And
mono destroyed you, dude.
Mono destroyed me. Also, these GLP-1's act on your liver, and so does mono. So I had to stop it for that. And then mono, also apparently you don't have an appetite. So I also didn't eat. And so I had to not take it to not lose any more weight. So that was unfortunate. But now I started the Wegovy pill.
Oh, wow.
Yeah, I've been taking it for 2 months.
Is it cheaper? More cost effective?
Yes.
Okay.
It's not cheap, but it's cheaper.
And still out of pocket for you, right?
Yup.
Oh.
Mine is also out of pocket, and I go through Lilly Direct.
Yeah.
And it's like $400 a month.
Yeah.
For my medication.
Yeah. It's expensive.
Yeah, it can be.
The cost you pay to not have inflammation ruin your life.
Literally. And that's why
Literally.
it's just so hard, because I have patients, again, now I have like another 5 who came in, also didn't want to tell me they were taking a GLP-1. They started like, oh, don't judge me, but, and I was like, girl, like, who cares? But those patients in particular were also taking it for endo or PMOS, not weight loss. And so they're like microdosing it, just kind of like what I did, and presumably you. And it's unfortunate because like these 5 people can buy it. And then I have I do have one patient who gave me permission to share this story, that she didn't qualify. So she bought Zepbound through Ro or Mochi or something like that. And it was too expensive. And so after 3 months, she had to stop taking it because of the cost, and called me at the clinic. And she was like, all my symptoms are back. She was like, I'm going to go to Mexico and get it on the DL because she was like, I need it. And so that was just so frustrating, because again, they can be really helpful for folks, but they are just so expensive. So it's up to these insurance companies to cover it for other things, but that research needs to catch up, I feel.
Yeah, for sure.
Yeah.
And just shitting on insurance really quick. The reason it doesn't cover mine is because I don't have like a diabetes diagnosis, and the only thing they categorize it as is a weight loss medication.
Yes. So
And
your
Blue Cross Blue
BMI
Shield
needs to be
doesn't-
like whatever. Yeah.
Which my insurance doesn't cover weight loss medications at all. At
Yeah.
all. So it actually doesn't matter how much I qualify. Because
is
even my
crazy.
GP was like, I'm prescribing it, so it is medically necessary. They can't
Yes.
say it's not, but they don't cover weight loss medications.
Yeah. So you're paying out of pocket, and it's so expensive.
wild.
It's wild. Yeah.
I'm feeling hyper emotional today, and literally you just saying that made me want to cry.
It's so sick.
Yeah, it's sick.
That infuriates me.
Yeah.
Also,
Yeah.
hearing BMI brought into the conversation at all
Yeah.
is going to consistently send me into a full out rage.
Yes.
My BMI has never once been in the normal range
No,
for
dude,
my height.
no.
I was on the Wii Fit. I was on the Wii Fit.
The
doing
Wii Fit
those
killed
steps,
me.
just stepping up and down, stepping up and down.
Oh my God.
Just trying to get my BMI
just gave me
down.
my PTSD.
I will never forget me and my
God.
2 sisters.
Literally.
Sorry, me and my 3 sisters. My one sister was like underweight, and me and my 2 sisters were like overweight / like
shamed
obese.
you.
Also, we were like what, 5th grade?
Yeah, like little
Just
girls,
like
10.
I remember crying on the stairs, just being like, oh my God. I
Because
just
like you
Oh my
never thought
God.
about that until the Wii Fit.
literally the Wii Fit.
Yeah.
Yeah, the Wii. Yeah.
Yeah.
You know what? Wii Fit would probably be covered by insurance.
We don't cover weight loss medications, but we cover Wii Fit.
We should try stepping up and down on this like half-inch step like 1,000 times. Maybe that'll
get
help
it for
you.
you.
That'll help. Oh my God, so fun. Okay, but it's really fascinating to hear a first-hand experience with endo, because this is the one where I'm like, I have a lot of the knowledge around it for PMOS, just because that was like why I was prescribed it. But I also think people have been talking about that a little bit more. It's an easier leeway from type 2 diabetes, right? Because it has the insulin resistance piece.
Yes.
Can you dive a little bit more into the general impacts it might have on endometriosis?
Yeah. So kind of like you said, it's, not as like straightforward. Like PMOS has, these hormonal imbalances, and endo doesn't. So it's like, where does that come in? not a lot of research on it, obviously. Again, I was looking at things only from 2025 and up to keep like the most up-to-date stuff, but they are coming across like benefits with endometrial cancer. Endometriosis itself is thought to get better through the anti-inflammatory component. So it's been well established that endometriosis is an inflammatory disease, and GLP-1's are, so the hormone GLP-1 is secreted in response to inflammation in our body as well. So like I said in the very beginning, it's released when we eat food. It's also, the more inflammatory markers we have, we're finding that the more GLP-1 is released as well. And then vice versa, that GLP-1 cleans out all those inflammatory markers. That's the leading theory right now with endometriosis. That's kind of all we got. So they're doing studies again at the endometrial tissue where there are presumably GLP-1 receptors and its influence on cancer. And then there are a few preliminary endo things coming out, all related to the inflammation is what I found.
Okay. Makes sense.
Yeah.
Freaking inflammation, man.
Crazy.
But yeah, it's cool that we even have anecdotal research on this stuff, because if you think about like the field of pelvic floor physical therapy, it's still brand new.
Yeah.
In terms of research on interventions, some manual therapies. That's why there's so many debates on like what it is, what's the best way to do it, which Hannah and I have talked about, but it's the same concept of like, this is a newer thing, it's being studied, and everyone's going to have their opinion on it.
Yeah.
Because also a lot of the conditions that this is being studied for affect mostly women.
Yes.
So there's a lot out there, and we know that not everything has to be completely research-based to prove its effectiveness, right?
Totally.
If you think about egg freezing, which I did recently, they've been creating babies in labs for 20 plus years, and it's still not an FDA approved thing. Like, it's kind of crazy.
It's crazy
how some of this women's health stuff moves through the government and the FDA.
For real. You guys both just looked at me slowly. I was like, no, you guys are going off.
Real.
No, you guys are popping off.
All right. That was my thing.
Yeah.
I contribute to that statement.
You did.
Is there anything else we want to touch on in terms of like endometriosis and what we're finding there with GLP-1s?
I don't think so. Just that, to round that discussion out, research is coming out. It's looking promising. What's happening?
Why are you doing that?
I think I'm losing my mind. I'd say.
Hold on.
I was like, I hear like deep breathing into the microphone. That was terrifying.
I'm not well.
It's okay. You're doing great.
Amanda's still recovering from her egg freezing.
Oh my God. It's so bad.
I know.
It's fine.
Anyways, okay. Is there anything else we want to talk about in terms of endometriosis and GLP-1?
Yes, that's what we were talking about. Just to round out, that research is coming out soon. It's looking promising. But just a reminder, again, talk with your doctor. A lot of doctors might not be aware too, so it might be helpful to again, present some research or something like that if you think this could be right for you. Might not be. So again, kind of looking into it as you will. And then just seeing a lot of good anecdotal evidence at the clinic.
Also such a slay that you reached out to your OB or your gynecologist after and you were like, hey, by the way, like this is helping me a lot.
Yeah, that's a whole other story about how I was kind of told it wouldn't be helpful. So that's why I went to my PCP.
Yeah.
So yeah.
So, I mean, that's another important take on sometimes you need a second opinion.
100%.
Hey, where have we heard that before? Pelvic floor therapy won't be helpful during pregnancy.
Oh my God, don't even get us freaking started.
We were hear it.
We were literally talking about that conversation. We were having that conversation in the clinic last week.
Yeah.
Wild.
Just happened to another patient.
That came up to you and was like, oh, my doctor said pelvic floor PT won't help me.
Yeah. She asked for a referral and the doctor was like, oh, no, it's okay.
This is what I tell.
No.
Quick side note. If you ever have a doctor tell you that physical therapy is not going to help you, I would severely question that.
Yeah.
Because physical therapy is a practice that can do nothing but help benefit your
100%.
daily life
100%.
and is the least invasive approach to anything you can do.
Yeah. Wouldn't hurt to try it, you know?
So anytime someone tells you you don't need PT, I would second guess that.
Yeah.
Anyways.
Yeah. Anyway.
That's not what we're talking about today. Today we're talking about GLP-1s. We've talked a lot about the positives of GLP-1s, obviously, and you guys have shared your experiences. Amanda, even off camera, shared with us how it helped with her acid reflux.
Yeah, big time. Like, I don't know if you guys remember. Probably not, because we would edit it out. But
because Hannah remembers.
and what's interesting is I'm having it right now because I haven't been on it because of my egg freezing. But like, if you remember,
there it was.
I used to do that a lot when we first started our podcast because I have like esophageal reflux. And something I didn't even notice the GLP-1 helped me with was that, where I just haven't had any like speaking hoarseness issues, feeling like there's a golf ball in my throat ever since being on it. And now that I've been off it for a month or so, I'm noticing it again. It's so fascinating.
You guys don't even want to know how many times she would go like this, like literally.
Yep. It was one of the reasons I was like actually nervous to be on a podcast because I hated my speaking voice because it was so hoarse. And now I'm like, I love my voice.
Yeah, your speaking voice is beautiful.
Yeah, thank you.
Even with the throat clearing.
Thanks.
And I edit it out anyways. Only I suffer.
True.
Yeah.
And it doesn't bother me that much. It takes a lot to bother me.
Yeah, I know.
I just like make fun of you because it's funny.
Yeah, thanks.
So you can clear your throat. It takes a lot to get under my skin.
It does.
Get under her skin, and I've done it. So
And one of those things is doctors saying you don't need physical therapy.
and talking about BMI.
Oh my God.
Oh yeah. Okay, anyways, so we touched on endo.
Yes.
There's always new research coming out. Always.
Totally.
That's what I tell people also, like, that are in the realm of their endometriosis treatment and finding what works. There's so many new things constantly coming out.
Yeah, I think we're getting a big boom of that right now.
Big boom. It's kind of like,
I think because men can have it. I think that's what this is not research based, but I saw something about how like a man had like a ton of excess like estrogen or something and like had endo, I don't know. But then
Amanda's rolling her eyes.
But then they were researching it because they're like, well, man got it. So now we got to like figure that out.
Literally.
Well,
that makes perfect sense.
Yeah. I don't know if that's true.
And also with like social media booms, right? Like
100%.
This is the same thing that we're seeing with getting anesthesia for IUDs, getting more research in perimenopause, menopause care. We're getting, more research on endo because people are getting on social media and being like, fuck this shit.
Yeah.
I'm out.
Yeah.
And then we're like, okay, maybe we need to do something. Doctors are like, oh, wait, maybe we can change something.
Yeah. And some people are working on it.
I feel like that's
Also,
a contributing factor.
what's the incentive? They figure stuff out. They can make new medications. They can sell them.
Yep.
Like, this is an untouched
So
area. So
money-making
people are like,
factory.
oh, I guess we'll do that next.
Yeah. I guess.
We'll be the first.
Yeah.
We're all feeling crazy today.
Yeah. Feeling aggro.
So do we want to talk a little bit about the side effects of GLP-1?
Sure.
We talked a little bit about it, but let's go into some things that people presumably say they can get.
Yeah, so that's a good distinction because there are true side effects. Just like, you can look at any medication out there on the market, there are side effects for it, right? So I'm not saying that that's not true. However, I did want to speak on the side effects that are not from GLP-1s. So I was on maybe Instagram today or something, and there was like this crazy post, and it was like, oh, like 80% of people on Ozempic like lost their hair and all this stuff. And there's a lot of things that are being sensationalized right now, such as I saw an article that it's shredding your bones or something like that. And they had like a picture, I don't know, just some crazy picture. And so like,
What does that even mean?
No one knows. But that's what I'm saying. People are like, oh, I don't want my bones shredded. So like, I'm not going to take that. And I get that for sure. But there's a lot of things right now that are like not from the GLP-1 itself, but from rapid weight loss. So if you were to not eat food, whether that's on a GLP-1 or not, you're going to have hair loss. Mm-hmm. You're going to get osteoporosis. You're going to have muscle wasting and muscle atrophy. That's again why I emphasize the importance of doing this with a doctor or a nutritionist or like a big group of healthcare providers around you, because if you are taking a GLP-1, you're resistance training, you're eating protein, you're not going to, again, I am not a medical doctor, but you're kind of checking off the preventative boxes there. Mm-hmm. And so again, there are true side effects, right? Like there are gallbladder risks, there are perhaps pancreas risks. And so I won't speak to those, but as a healthcare fitness provider, a lot of these side effects are not they're just from taking this medication irresponsibly.
And there's GI upset.
Yes, and that's fine. Yeah.
In either direction.
Yes.
Everyone has a different
Everyone's
experience
different.
with that. But yeah, that's a really good point. I think because I also, when I first started taking it, I did notice the appetite like decreasing. Yeah. My biggest thing that I noticed was like I did not want to touch water. I was like, water's disgusting.
Curious.
It's so boring.
Yeah.
I never want to look at it again. I still feel that way. Like I still don't want to drink water.
Okay.
It has to be more exciting.
Yeah.
I'm like, put something in it. I need it to be exciting. But I will say, like, what I really loved about my doctor was she emphasized the weight training, which I was, already doing.
Right.
But I got really consistent with my strength training, and it forces you to need to eat protein to feel good.
It's a good cycle.
It keeps you accountable, and you're not losing muscle mass. You're still able to gain muscle.
Yeah.
I've gotten so much stronger being on a GLP-1. Like,
100%.
it is not something that's impossible for people.
No.
Yeah. Let's say it all three at the same time. What's really important? Strength training.
Oh, yes, it is.
You didn't count us down.
Yeah.
Okay.
I was like, what are we saying?
It's like, where's the time?
Okay, ready? 3, 2, 1.
Strength training. Proper nutrition.
Yeah. But again, all super important for real. And
Yeah.
that's another thing is people are like, oh, well, you're going to take it forever, which one, it's been around for 20 years. So there's research, I'm sure, now coming out about like prolonged GLP-1. We don't know a lot about that yet, and that's very fair. But I feel like if you're building all these healthy habits, then yeah, that's kind of like what you're learning and taking away from the medication. If that's your focus is weight loss, then you can build in these healthy lifestyle factors and you can get off of it. That's a big argument I see that's, I think, very unfair to people who are taking it for weight loss. Because if they do end up needing it forever, that's also none of your business. It's not like someone has high blood pressure and I'm like, well, let me take that away and see if it, stays down or not.
Right.
For real, dude.
Yeah. Obesity is a multifactorial problem. You know what I mean? And so, but that's to say, yes, I feel like if you build in good lifestyle habits, you definitely can be off of it if that's what you and your doctor think is best.
Yeah. No additional notes. That was great.
Yeah, 100%. Do you want to go into any of the other scary headlines we're seeing about GLP-1 and kind of like myth bust those real quick? Because
I mean, have you seen, because like those were the big ones I saw, was the bone shredding.
That one is cracking me up.
It was insane. It was like, like when they had
some
that
Game of Thrones stuff.
Yeah.
I'm sorry. I can't go one episode without mentioning Game of Thrones.
No, you can't.
It was like that one post that was like a healthy lung, like next to a smoker's lung.
Oh my God.
But it was like a healthy bone next to a shredded bone. I don't know. But yeah, those are the big ones I've seen. The bone shredding, hair loss, Ozempic face, and the muscle atrophy, right? So like those are all things that if you are taking this medication responsibly and taking care of your body, you don't have to worry about. But yeah, there's probably other ones, I'm sure, but those are the big ones that I've heard about.
If you guys have heard any, leave a comment. If you want us to like dive into any other ones and kind of myth bust too.
Yeah, because the GI ones, again, those are real side effects. So well established: nausea, vomiting, diarrhea, or constipation. Again, like you're kind of going to fall in one of those houses. However, they're showing that those will reduce the longer you're taking the medication. So if you do up your dose.
Oh, yeah.
Yeah.
I projectile vomited
No,
when I first started taking it.
That's horrible.
Like, I've
You needed water.
I've never ever done that.
Yeah, no,
It shot out of me.
Are you drinking more water now?
That's what I'm saying.
No,
She needed to be.
I think I'm bored with water.
For real, it's not even the GLP-1.
I've been drinking water for 31 years. I'm
This is true.
bored.
Yeah.
I am bored. Give me something better.
Put some noon tablets in there.
I think I might
put some LMNTs in there.
Yeah, I'd be doing that.
Yeah.
Yeah.
Right now, actually, I miss water because I can't drink water with my
You always want what you can't have.
post-freezing ovarian issues. I have to only drink electrolytes.
Really?
It's weird, yeah.
That is weird.
Because my estrogen was super high, so I'm at higher risk for OHSS,
Okay.
which is ovarian hyperstimulation syndrome. And then the fluid shifts. Like you can build up fluid in your abdomen, so you need extra salt and less like plain water
This is perfect for you.
to distribute it.
Yeah.
That is perfect.
So I have been less bored,
I'm happy.
but now I kind of want water.
Yeah, I've been trying to drink
Can't
more
win.
water too lately. I will say when I was playing volleyball on the beach for 7 hours yesterday, I was going through water.
Very good.
So, I mean, that helps.
It does.
Yeah. That's a good point. My hot take for social media and GLP-1's. I am starting to hate social media, which I was already starting to hate it. We use it for work, whatever. I'm happy to be on there, but like actually scrolling is becoming so fucking annoying because between all the AI shit and then every comment section of any human being and their body, no matter what it looks like, is like, oh, Ozempic. Oh, like they're on Ozempic.
Yeah.
I'm like, one, can you be more boring?
Literally.
Like, get a personality. This is just isn't a comment you need to be making. Stop commenting on people's bodies.
That's where I'm at. Is just if they're on it, they're on it. If they're not, they're not. It's not your body. It's not any of your business.
Literally.
Yeah.
I think you're just jealous that people are living happy, healthy lives. And that's why people are commenting that.
Could be. Yeah.
You saying the person commenting.
Yeah. People.
I would
Evil
say
comments.
any disrespectful comment is definitely a you issue.
100%. Yeah.
Right. It's never about like the person you're commenting on.
Yeah.
I mean, but you see that stuff on like people with like bigger bodies and they're going to, in the
Yeah, you
comments,
see the
they're going
flip
to be
side
like
of it.
unhealthy.
Yeah.
This is terrible. Like, sorry, this is a healthy body and this is a healthy body.
Exactly.
And
And you're projecting your fat phobia onto that person.
Yeah.
And they could be completely healthy.
Yeah.
Like, it's wild.
It is.
I feel bad for you
yeah.
Yeah.
if you're wasting your time and commenting on other people's
Literally,
bodies.
like go touch grass.
Yeah.
Not that serious.
No,
Go
literally.
touch it. Crazy.
All right, we're getting crazy.
We're getting
do we
weird.
need any other big takeaway? This is always how the Pelvic Freak Show goes.
Yeah.
We be talking about big things in the media, and then we get angry.
Yeah.
We get angry.
Yeah. It happens.
That was a really comprehensive episode. I think this episode, I almost wanted to title this like the only GLP-1 conversation you actually need to listen to, because like this is what I want people to hear before they go and watch those ads and make those comments. And we're talking about it from an evidence standpoint. We're neither here nor there. We're just saying that this is a medication that exists and to exercise caution if you're using it.
Yeah.
But there are very real uses for it and the evidence is growing. So thank you, Hannah, for running through all of the research that you did on
Yes.
And
Sure.
what is the downside of this? This episode is literally presenting to you like, here's the research. Here's what's out there that you can literally go on WebMD, not WebMD.
Don't go on WebMD.
Don't do that. I'm trying to think of the research database website.
Google Scholar.
Google Scholar, sure. It's
a good place
It's
to
not the one I was thinking of, but whatever. Go on Google Scholar, find this, type in these trigger words. We're literally linking them in the episode description, presenting you with this information. Take it to your doctor and say, like, here, I found this information, saw that it could be beneficial. What do you think about this for my clinical presentation?
Yeah. I think
And
that's fair.
then go from there. You know what I mean? If you find that you feel like it will be beneficial.
Yeah, and if you don't, that's also fine.
Yep.
Like literally,
Yeah.
not everyone needs to be on it. You know. Yeah.
Good stuff.
Good stuff.
All right, Pelvic Freaks, we hope you got something out of this episode. And if you have any comments, we do reply to all of them. So leave a comment on Spotify or podcasts or follow us on social media at The Pelvic Freak Show. Please leave us 5 stars if you've been enjoying the podcast so we can expand our reach. And Hannah Kotsiris, did I say that right?
You did.
Would you like to close us out by saying bye, Pelvic Freaks?
Bye, pelvic freaks.
Bye, Pelvic Freaks.
Bye, Pelvic Freaks.